What if one simple cup could help your body feel a little stronger during one of the hardest journeys of life? Not cure cancer, not replace treatment, not do the job of doctors, chemotherapy, radiation, surgery, immunotherapy, or any medical plan, but support the body. Because when someone is going through cancer treatment, the body is not only dealing with the disease, it may also be dealing with tiredness, nausea, dry mouth, poor appetite, weight loss, vomiting, diarrhea, painful swallowing, taste changes, and days where even eating a small meal feels difficult. And during those days, even simple things matter. A few sips, a little nourishment, a drink that feels easier than solid food, a warm cup that brings comfort when the body feels weak. Today we're talking about 3 ordinary drinks that may help support the body during cancer treatment when used the right way. They are not miracle drinks. They do not kill cancer. They do not shrink tumors. But they may help the body stay hydrated, take in useful plant compounds, maintain some energy, and feel a little more comfortable during treatment. And by the end of this video, you'll know which 3 drinks are worth considering, how to prepare them in a healthier way, and which drink cancer patients should be very careful with. Before we go further, this part is extremely important. No tea, no coffee, no juice, no cocoa, no herb, and no homemade drink has been proven to cure cancer on its own. Anyone who tells you that a drink can cure cancer is giving false hope. And false hope can be dangerous when it makes someone delay real medical treatment. Cancer treatment must always be guided by qualified doctors and the oncology team. Depending on the person, treatment may include surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy, hormone therapy, or a combination of these. Every patient is different. Every cancer is different. Every treatment plan is different. So the goal of these drinks is not to fight cancer directly. The goal is support. Support the body with fluids. Support comfort. Support energy when appetite is low. Support a routine that feels normal during a time that feels anything but normal. Before we talk about the 3 drinks, let's understand why fluids matter so much. Your body depends on water every single day. Their blood needs fluid to carry oxygen and nutrients. The kidneys need fluid to help remove waste. Their digestion needs fluid to work properly. Their body temperature depends on fluid balance. Even your cells need fluid to function. When the body does not get enough fluids, warning signs may appear. Weakness, dizziness, thirst, tiredness, confusion, dry mouth, headache, and that heavy feeling of being completely drained. Now imagine this happening during cancer treatment. Some patients lose fluids because of vomiting. Some lose fluids because of diarrhea. Some sweat more because of fever. Some cannot drink enough because their mouth hurts. Some struggle because food tastes strange. Some have no appetite at all. This is why hydration becomes so important. Water should always remain the foundation. But for some patients, plain water becomes hard to drink. It may taste metallic. It may feel boring. It may make nausea worse. Or the patient may simply feel too weak to drink a full glass. That is where small, steady sips can help. Instead of forcing a big glass at once, a patient may tolerate small sips throughout the day much better. Ice chips, soups, broths, smoothies, milk-based drinks, and oral rehydration drinks may also help, depending on what the medical team recommends. And now, let's talk about the 3 drinks. The first drink is tea. Green tea, black tea, oolong tea, and jasmine tea all come from the same tea plant. The difference is mainly how the tea leaves are processed. Tea naturally contains plant compounds called polyphenols. These polyphenols are known for antioxidant properties, which means they help the body deal with unstable molecules called free radicals. Free radicals can contribute to cellular stress, and this is one reason tea is often discussed in relation to general health, inflammation, and the body's natural protective processes. But let's be very clear, tea does not cure cancer. Tea does not replace treatment. Tea is simply a drink that may fit into a healthy routine when the patient can tolerate it. For many people, tea is gentle, familiar, and comforting. A warm cup can feel soothing, especially on days when eating feels difficult. But the way you prepare tea matters. Place a tea bag or loose tea leaves in a cup. Pour hot water over it. Let it steep. Green tea usually needs a shorter time. Black tea can steep a little longer. Then remove the tea bag or strain the leaves. The healthiest version is usually unsweetened tea, because once you add several spoons of sugar, the drink changes from a supportive beverage into a sugary dessert. If someone wants a creamier taste, a small splash of unsweetened almond milk, soy milk, cashew milk, or regular milk may be enough. And if caffeine is a problem, decaffeinated tea may be a better choice. Green tea gets a lot of attention, but black tea is also a reasonable option. The best tea is not always the trendiest tea. The best tea is the one the patient can actually enjoy and tolerate. But there are cautions. If someone has mouth sores, painful swallowing, severe nausea, acid reflux, or a sensitive throat, very hot tea can make things worse. Always let it cool first. And if caffeine causes shakiness, anxiety, sleep problems, stomach irritation, or heart symptoms, talk to the care team before making tea a daily habit. The second drink is coffee. For some people this may sound surprising, but coffee is not only a morning habit. Coffee beans naturally contain plant compounds, including chlorogenic acid, which has been discussed in relation to antioxidant activity, metabolism, circulation, and inflammation. But again, this does not mean coffee treats cancer. Coffee is not medicine. Coffee is not a cancer therapy. Coffee is simply a drink that some patients may enjoy and tolerate during treatment. For a patient who is tired, a small cup of coffee in the morning may help them feel more alert. And during cancer treatment, even feeling a little more normal can mean a lot. But coffee must be prepared carefully. Brew it the normal way. Filter coffee, machine coffee, French press, or whatever method you already use. The main thing is to avoid turning it into a sugar-loaded drink. Sweet syrups, whipped cream, flavored creamers, and large amounts of sugar can add many empty calories without offering the kind of nourishment the body really needs. A better option is plain coffee, or coffee with a small amount of milk or unsweetened plant milk. If caffeine is a problem, decaf coffee can give the flavor without the same stimulant effect. But coffee is not right for everyone. Caffeine affects people differently, but it can worsen anxiety, but it can cause shakiness, but it can increase heart rate, but it can irritate the stomach, but it can worsen acid reflux, but it can disturb sleep, but it can contribute to diarrhea in some people. And if someone is already dehydrated, coffee should never replace water as the main source of fluid. But patients with heart problems, digestive issues, kidney concerns, diabetes, sleep problems, or treatment-related diarrhea should be especially careful and ask their medical team before drinking coffee regularly. So coffee can be useful for some people, but for others, it may create more discomfort than benefit. But the third drink is high cocoa hot chocolate. But this does not mean the sugary hot chocolate packets from the grocery store, but we are talking about real cocoa, unsweetened cocoa, or dark chocolate with a high cacao percentage. But cacao comes from a plant and naturally contains flavonols and polyphenols. These compounds are often discussed in relation to blood flow and the body's natural repair processes. But once again, let's keep the message honest. High cocoa hot chocolate does not cure cancer. It does not fight tumors. It does not replace medical treatment. Its role is supportive. And for some patients, it may be helpful because it can provide fluid, comfort, and some calories in one warm drink. This matters because many cancer patients struggle to eat enough solid food. When appetite is low, a nourishing drink may feel easier than a full meal. A warm cocoa drink made with milk or fortified plant milk may be easier to sip and may give the body some energy at a time when eating is difficult. But there is a big difference between real cocoa and candy. A chocolate bar loaded with sugar is not the same as unsweetened cocoa. A sweet instant hot chocolate packet is not the same as a high cocoa drink. Many chocolate drinks contain lots of sugar and fat, but very little real cacao. So preparation matters. Start with about 1 tablespoon of unsweetened cocoa powder in a cup. Add a small splash of hot water first. Stir it into a smooth paste. This helps prevent dry lumps. Then slowly add more hot water, milk, or unsweetened plant milk while stirring. Let it cool before drinking, especially if the patient has mouth sores or throat sensitivity. Avoid adding too much sugar. If the taste is too bitter, a small amount of milk or an approved sweetener may help, depending on the patient's diet and medical condition. Another option is to melt a small piece of dark chocolate, around 70% cacao or higher, into warm milk or hot water for a richer drink. But anyone with diabetes or high blood sugar should be careful, because cocoa drinks can quickly become sugary if prepared the wrong way. So tea, coffee, and high cocoa hot chocolate are the three drinks worth knowing about. But there is one more drink many people ask about: pomegranate juice. Pomegranates naturally contain plant compounds, and many people connect pomegranate juice with health. But pomegranate juice is not a cancer cure. It should never be presented as a treatment. If a patient enjoys it and the medical team says it fits their condition and medications, a small serving may be fine. But more is not always better. Fruit juice contains natural sugar, but it usually does not contain the same fiber as the whole fruit. Fiber slows down how quickly sugar enters the bloodstream. Without that fiber, juice can raise blood sugar faster. This is why whole fruit is often different from fruit juice. Also, some foods, juices, herbs, and supplements may interfere with certain medications. That is why patients should always ask their doctor, nurse, pharmacist, or oncology dietitian before adding juices or supplements during treatment. Now let's talk about the drink cancer patients should seriously limit: alcohol. Alcohol does not hydrate the body. It does not nourish the body. And during cancer treatment, it may work against recovery in several ways. Alcohol can worsen dehydration. It can affect sleep quality. It can irritate the stomach. It can affect judgment around food choices. And it may not be safe with certain medications or treatment plans. Some people think alcohol helps sleep because it makes them feel drowsy. But real rest is not the same as feeling knocked out. Alcohol can disturb deeper sleep and leave the body with lighter, broken, less restorative rest. During cancer treatment, sleep is already precious. Hydration is already important. And the body already has enough stress to manage. So alcohol should never be used as a sleep aid, pain reliever, or stress coping tool during treatment. If alcohol is part of someone's normal lifestyle, they should ask the medical team directly whether it is safe for their specific condition and medications. Now here is the message that matters most. Tea may help some patients feel comforted and hydrated. Coffee may help some patients feel more alert and normal. High cocoa hot chocolate may help some patients take in fluid, comfort, and some calories when eating is hard. Pomegranate juice may be okay in small amounts for some people. But none of these drinks are treatments. None of them are cures. None of them should replace medical care. Their role is supportive. That's it. And supportive care still matters. Because when someone is going through cancer treatment, the body needs steady help. Not hype, not miracle claims, not fear, not false promises, just practical support. Water should remain the foundation. Tea and coffee should be used only if caffeine agrees with the body. Cocoa should be real cocoa, not a sugar-loaded chocolate drink. Juice should be used carefully. Alcohol should be limited and discussed with the care team. And every patient should remember this: what helps one person may not help another. One person may tolerate tea beautifully. Another may feel nauseous from it. One person may enjoy coffee. Another may get heartburn or anxiety. One person may benefit from a warm cocoa drink. Another may need to avoid extra sugar. That is why the safest approach is simple. Use drinks as support. Keep the medical team informed. Listen to the body. And never treat any drink like a miracle cure. The goal is not to find one magic cup. The goal is to help the body stay hydrated, nourished, and comfortable, while proper medical treatment does the real work. So here's my question for you. If you or someone you love were going through treatment, which of these three drinks would feel easiest to start with? Tea, coffee, or high cocoa hot chocolate? Share your answer in the comments. And if you or someone close to you has gone through cancer treatment, tell us what simple food or drink helped during the hardest days. Your experience may help someone else watching this right now. If this video helped you, hit the like button and subscribe to The Healthy Years. Here we talk about healthy aging, nutrition, disease prevention, and real wellness without miracle claims and without fear. Just simple, honest health information your body can actually use. We'll see you in the next one.